Hello. Hello.
Hello.
Joker
Hello.
presents LMHC. Hello, Miss Emmeline. Good day, good evening, good afternoon, good night, goodbye, good show. Thank you, guys.
Good day, sir.
I say good day, sir.
I said good day.
Um, so when me and M don't talk for a while, we have ADHD moments and we just
I have to
stem
recoup.
randomly. So that's why I said we just stem randomly and we talk about random stuff that makes no sense. But it's all
hmm
right. This is our safe
It
place,
makes
safe
sense. It
space.
makes sense to us though, so it's
It
okay.
does. Ish. um, let's talk about it. Let's talk about the funness. This is a very interesting topic that neither one of us picked, and we're going to do our best to break it down. It's called somatic psychology, which is both to look at how, because somatic is relating to the body, but it's especially distinct from the mind. So somatic psychology looks at how your mind and your body connect and affect each other. So sort of like the idea of psychosomatic. And what is your understanding of somatic psychology, somaticism,
Um,
somatices,
so
somaticide?
somatic, with somatic, I upon reading more about it, I think of like how I have clients who do like pseudo seizures. It says on there, like
Mm.
diagnosis or pseudo. What was the other one? I forgot what the other one was. And I was like, oh, this is what it like correlates to it. So I was like, interesting.
Yeah.
Um, I have no one who is diagnosed with this that I've worked with. However, the somatic um, therapy, I've seen a lot of that on like my Facebook feed of
Mm.
just like, but like it's like, oh, do the somatic workout to lose weight. Like that's how it's targeted towards like my Facebook, and I was like, interesting.
Yeah.
But I don't got time for that. I'm like, that's an awesome rabbit hole to go down, but not today.
I do think that a lot of the somatic work is really geared towards the country as a whole. Like I would say the field as a therapist and ABA, we're moving towards more holistic healing and holistic medicines and approaches. So I do think that that move towards that is probably why you're seeing all these things and people are perpetually obsessed with their weight. Where me, I'm just
Oh,
okay with being, fat. I'm okay with that.
you're okay with that. That's good.
I've accepted that. Me and Achille had a conversation and it went well. And we only got interrupted one time.
Because I wanted to eat nachos.
Exactly. Carbs. Carbs are
Carbs.
great. Carbs.
Carbs, yeah.
I
Carbs are
love
great.
carbs.
Yeah. I
Hello,
like
Jimmy.
I, I like carbs more in the winter. More of those like breads and pastas in the winter.
Animal. Only in
Yeah.
the winter.
Yeah.
That's last episode in.
I know. Oh
Um,
yeah.
so let's try to wrestle this in. It's a lot of stuff actually to cover, but we're only going to be on for about an hour. M's not feeling great. I have to watch The Color Purple with my amazing, wonderful wife. So
Aw.
cut it out. Um, so somatic symptom disorder changed to somatic symptom and related disorders. So somatic symptom disorder was an explanation in order to make the diagnosis of medically unexplained symptoms and gain access to appropriate treatment. The emphasis is on the symptoms that are substantially more severe than expected in association with distress and impairment. They used to focus on is what wasn't being seen, like hypochondriacs. Even though they've
Mm.
they've eliminated that title, they focused on what wasn't seen, but now they're moving more towards what's actually being seen, and the diagnosis with no medical explanation, where there's some underlying pathology, but an exaggerated response. That sounds really nice. So,
It's
somatic
true.
symptom disorder emphasizes diagnosis made on the basis of positive symptoms and signs, distressing somatic symptoms plus abnormal thoughts, feelings, and behaviors in response to these symptoms, rather than the absence of a medical explanation for somatic symptoms. So, they're looking at how the symptoms affect the body and how they affect the psychology, which is when you have the whole idea of like something being psychosomatic, how we process a lot of our feelings and emotions through our stomach. Because if we don't feel good, it usually means we've been having a rough day or we're stressed. Excellent contribution, Em. Yes.
Um,
Okay. Done.
yeah, I agree. But I like see I actually have like ulcerative colitis, so
Mm.
stress is very bad for colitis. So
Mhm.
therefore, I try to keep very mild and cool, so that way it doesn't bother. I don't have
Mm.
it bother my stomach.
Another, I think the biggest sign is that when you look at somebody who's pregnant, a mother who's pregnant,
Mm,
and how the different types of stress affect the pregnancy, it can affect the baby, what you eat, how you feel. All of those things are kind of contributing to how the pregnancy goes. I've been told, because I will never know what it's like to have a baby, and I don't want to. I don't want to know
mm.
what it's like to be pregnant.
It is
Um,
not. It is
you
not fun.
guys
It's
may.
fun, but it's not.
It's not fun at all. It's zero fun allowed, sir. To quote, um, remember the Titans. Do you think that um, your pregnancies would have been different if you had more or less stress? Because
Uh,
I've never got pregnant.
so that is a very good question to ask me because with my daughter, when I was pregnant with her, I had I would say I had no stress in the sense of like my environment. Considering I worked at a school for a non-for-profit school for individuals with autism and were extremely uh, could be extremely aggressive and stuff like that. I would say that that point in my life, I was still in my 20s and I was pretty stress-free in that sense. Um, my pregnancy was amazing with her. I was doing prenatal yoga up until my third
Mm,
trimester, and like other ladies had lots of like neck pain and back pain, or like their hips were uncomfortable. I didn't have that, but I was
mm,
also had distractions because I was actually working on my master's at the time. So my last trimester I was writing my thesis, and actually gained more because of writing my thesis and I was in my feelings. So I ate more. I
mm,
gained more weight during my third trimester. But she came out, she was a C section. She was 7 pounds, 7 ounces, 21 inches, and she was beautiful and she was perfect. No NICU, no nothing. Um, six, 6 years later, I was pregnant with Ethan and I was dealing with the stress. I was dealing with stress at work because I was now working as a clinician at
mm,
a group home, and I had a very like just you had to be um heightened of where he was because you could be in the line of fire. With his history, it could be aggressiveness, or it could also be, he had said numerous times that he wanted to rape me. Um, and I was hiding my pregnancy with him.
mm,
And then at home, I was dealing with my grandfather's first stages of dementia.
mm,
And then I had gestational diabetes. So, and trying not to, because the doctor wanted to put me on insulin, and I told him I was able to regulate myself. So,
mm.
Ethan came out 10 pounds
Ooh,
even. Yeah, I see. He was another
Mm.
C-section baby. Um, and he was in the NICU because he had still fluid in his lungs and stuff like that. So he was in the NICU for like 4 days. And definitely environmental stress and everything because he was diagnosed with autism and ADHD.
Oh boy,
So
that little. I didn't realize it was that young.
what?
He
That
was
he's that?
diagnosed.
No, he was diagnosed recently. Like,
Oh, okay. I was gonna say. I was like,
no, yeah, no. Be like, wow, they knew it
they don't
right
like
there.
this with his blood.
4 days in the NICU, and they're like, oh yeah, no,
Yeah.
you could tell by his eyes, his shifty
Yep.
eyes.
Yep.
No,
Shifty eyes.
so definitely, I definitely understand environmental factors being an issue where
Mm-hmm.
I thought I was keeping it calm, cool, collective, and I was under a lot more stress with him and balancing
Mm.
also my 6-year-old daughter and making sure that she didn't feel like she was being left out while I was, there was a lot of stress factors for Ethan's birth
Mm.
and
Mm.
development.
Um, that makes a lot of sense. So and it's interesting you talked about that because one of the distinctive characteristics of people with somatic symptom disorders is not the somatic symptoms, but how they present and how we interpret them. So how people interpret their somatic symptoms. Do I always have this headache? Do I always feel this stress? And a lot of times they're always looking for gestational diabetes, and they're always looking for all these things. They do the sweat test, and you do that, what is it, ASCAR or something like that test. I don't know.
Yeah. You want an answer because you
Yep.
want to make sure that you're not crazy. That's really what it is. Like you're like, well, let me check these things out. But then when you
Mm-hmm.
have like the people we support, like what's
Mm-hmm.
great about that is because we're constantly taking data on their behavior and when behaviors are for certain issues. Let's say like parents are upset at them, and then all of a sudden they're saying, "I don't feel good. My head hurts. I have stomach pains. I think I need to go to the hospital." And you're like, "Wait a minute. This is interesting that this happens every time your parents are mad at you." So it's like once you pick up on that, it's then like kind of like talking to them about their feelings. And for this particular person, it was realizing that a hospital's not going to help you take away the guilt. You know,
Mm.
you kind of have to ride that wave.
Mm-hmm.
With that particular person, I was able to decrease the 911 calls because when we figured out that this was an issue, it was a conversation. Like, this is the
Mm.
conversation you have to have with her now. And first it was me, and then it was me training staff, and then we were able to decrease that.
Mm. That sounds so much fun. Where
It
do I
was.
sign up? Um,
Nobody
so
wants my houses.
so the new category is the somatic symptom and related disorders. The related disorders are obviously somatic symptom disorder, illness, anxiety disorder, which is what it sounds like, which is probably hypochondria, but they changed the name. Conversion disorder, which is functional neurological disorder that with no underlying pathology that can explain it. Um, I like conversion disorder. That's interesting. Fictitious disorder. Fictitious disorder is a condition in which a patient intentionally falsifies medical or psychiatric symptoms. If you've ever seen Don't Say a Word with I think Brittany Murphy's the girl, and I don't remember off the top of my head. I know she was blonde, but she was pretending to be catatonic schizophrenic, and you have to be very complex and very, you know,
Dedicated.
yeah, to pretend to be catatonic schizophrenic.
Dedicated? Yeah.
Yes, I will. I'll have that catatonic schizophrenia.
Ooh, that's a good one. Schizophrenia in general would be an interesting one to deep dive.
Um,
So you say that, I think of um dirty scoundrels.
I never saw that. The
Um
movie, the
yeah.
cartoon.
No,
Oh, that
it's
was the
with
bad guys. That was the bad guys. Sorry.
that was a bad guys, which is a good one too.
What is that
Um,
movie?
it's Martin Short, and
Oh yeah, yeah, yeah.
they did a remake of it, but he pretends that he's, he he can't walk, and then the other guy plays like the psychiatrist that's going to help fix him. Meanwhile, the lady is trying to scheme them both from their money. It was a great movie, but that's what I think of. You think of Brittany Murphy's movie. That's the movie I think of.
Oh, okay, interesting. That's crazy at all. Cuckoo. Um, that wasn't a professional cuckoo, by the way. Also, we talked about the different symptomologies, conversion, and related disorders, which include pseudocious, a false belief of being pregnant that is associated with objective signs and report symptoms of pregnancy. I had one client I worked with. She was in a group home. She was pregnant, I think, for 2 years.
Oh my
And
god.
I was like, wow, the baby might be at term by now. She would always go like this because she was nonverbal, pointing at her stomach. And I was like, oh, the baby? She's like, yeah. I was like, oh, okay. So I didn't try to dispel her belief because it was a pointless argument.
Mm.
But it was interesting. So some of the symptoms, the diagnostic criteria. And diagnostic criteria is really how people come up with anybody that's making a diagnosis they have to meet certain criteria. The diagnostic criteria is you have to meet one of the following, and it has to be for more than 6 months. So that's the diagnostic criteria. Uh, Disproportionate and persistent thoughts about the seriousness of one's symptoms. When you see people that drug seek, they typically will exaggerate their symptoms and how serious it is because they want the drug. Persistently high level of anxiety about health or symptoms. That sounds like the whole world post COVID. And I feel like now that COVID's kind of become more common, people have stopped caring as much and they are a lot more sloppy with things.
Mm.
Hence the spread of RSV, the flu, COVID, and upper respiratory infections this past, well, I guess it's still winter, but this past winter. Excessive time and energy devoted to these symptoms are health concerns. And although any one symptom can be continuously present, the state of being symptomatic is persistently more than 6 months. So that means that you're persistently worried about it and consistently worried about it, that you have these symptoms and you have these things. So that's how they come up with the diagnosis of somatic symptom disorder, which is not something that I see diagnosed a lot, to your point, Em.
Yeah. I mean, like I had the pregnancy one. I have a girl who has said that too, but we've done like we've had her do pregnancy tests. We've had her go to the gynecologist, and once the gynecologist goes no, then she's like, okay, like all right, and then she'll move on. But now that she's been with us for a while, she hasn't done that in a while. I think it's been like a year or two now.
Mm,
Yeah,
that's so
so
much.
so she's become comfortable with us. Plus, she knows that we're not feeding into that.
So they also go into the diagnostic criteria for the other ones. I'm not gonna necessarily go into that because, as thorough as we want to be, it's a lot of stuff to go over, and it's kind of like a lot of the repeating of the same stuff. And to really be a diagnostician, you have to just be able to recognize little differences in people's personality and how they present and how they treat certain things. So, for example, I'm sure, Em, when you talk to somebody, you can kind of get a feel if they're autistic or not. It might not be
Yeah,
100% right, but I'm sure you probably kind of get, oh,
yeah, yeah. The
because
social the
your
social
ADAR goes off.
this the social cues. I mean, I have some that surprised me and have
Yes.
come to me and told me, and I was like, oh wow. But again, that means that I'm like, you're really good at masking, and they're like, yeah, I am. Like I was like, I'm like, you've done a really great job of masking.
Yeah.
I'm like, because I didn't know, and they're like, thanks.
Okay. Thank
Like,
you.
thank you. Yeah. It's
Um,
working.
I'm doing great, aren't I? So psychological factors affecting other medical conditions. A medical symptom or condition other than a mental disorder is present. So this is when I have something present that may be you said
Ulcerative colitis. Yeah.
ulcerative colitis.
Yeah.
Um, you could have ulcers and people will think it's stomach cancer. They will think it's, GERD. They'll think it's everything under the sun. Now, if I take that and that's making me anxious and causing my symptoms to kick in, then that becomes a problem. Why are you laughing at me, Emmeline?
Because I'm just thinking of my daughter. She learned about leukemia in grade school, and
Oh,
this is when we were trying to figure out what was wrong. Like she had these patches on her legs, and it turned out like they were from
do
like
you have
she has
reverse vitiligo?
no, she has kidney disease.
Oh,
um,
I like that
but
explanation better.
But when the doctor started talking and said that she had elevated white blood cells, she started freaking out because she's like, "Oh
Mm.
my God, does that mean I have cancer?" And they're like, and the doctor's like, "Wait, no!" And she's like, "But you said my white blood cells are elevated, and that's how these kids have leukemia." So, so she gave herself, a little bit of that, anxiety
Anxiety.
over like leukemia because like she knew that was symptoms, but they're like, no, 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 it's not that, it's not that.
Yeah.
So I can see where the illness anxiety disorders because everyone now when they have their symptoms goes right to WebMD and they're like, oh, I'm dying.
They go to WebMD. They go to
Symptoms say,
Google.
yeah,
Diagnose yourself. A lot of just so much telehealth now that a lot of times you can just tell a doctor you have a symptom and they're like, oh, all you have to do is know how to explain the criteria and explain what they should be looking for. And it becomes a lot.
yeah,
Psychological behavioral factors adversely affect the medical condition in one of the following ways. The factors have influenced the course of the medical condition between the psychological factors in development or exacerbation or delayed recovery from the medical condition. So if you have something and you're not recovering and you have these effects that are kicking in, you have these things that are kind of like affecting you. You're like, oh, well, why am I not getting better? Why is it not working? So now I had an upper respiratory infection for like 8 years in December. And, oh no, I actually started in November. And I was just like, the cough wasn't going away. And I got sick and I went to urgent care twice. And they were like, oh, well, you might have walking pneumonia. I was like, what happened to the upper respiratory infection? What happened to the sinus infection? They were like, you might have walking pneumonia. So they took a chest x-ray. They were like, you're clear. They were just like, oh, you just got to let it pass. You'll be fine. I was like,
yeah,
great. Thank you. Thank you. I
great,
appreciate
great.
that.
I'll just feel like shit for like another 2 months.
Yep. And because I did the antibiotics, I couldn't do another course because it wasn't going to do anything.
Yeah. Or
Um,
they try to give you stronger antibiotics and they still don't
no,
work.
they don't try to give me strong antibiotics. They just go, here, take NyQuil and take cough medicine. You'll be okay. Take your allergy
Oh,
medicine.
yeah.
Um, the factors interfere with the treatment of the medical condition. The factors constitute additional well-established health risks for the individual. Ooh. So if they're getting other symptoms that are actually legit symptoms and they're adding to the stress and the anxiety, that's also a thing. That's interesting. Um, the factors constitute, we said that already, Kelly. The factors influence the underlying pathophysiology, precipitating or exacerbating symptoms of necessitating medical attention. Oh, that's a very long sentence. Uh,
Yeah.
the underlying pathophysiology, like how your body works and the physiology of how it's affecting your body, precipitating that happens before or increasing the symptoms or underlying factors. We said that. We're not going to talk about all of that. Yeah, that one was pretty interesting. What's your understanding of somatic therapy? We talked about the psychology and the disorder enough. Let's talk about how we treat it.
I think that it is before I knew what somatic therapy was. I figured it was a lot of almost again going by like what I saw on Facebook
Yeah.
or I thought it was a lot of just like yoga and breathing techniques to really like release maybe like release emotions like that's what I thought it was. And then, you know, and there's like a bunch of stuff that people can do for somatic.
Mm.
You know, you have your, what is it? Your, mindfulness meditation is a big one.
Mm.
Um, I'm trying to see. I, mindfulness, it just seems like mindfulness is across the board with everybody. Like,
Yup.
like
Yup.
every kind of diagnoses I've been working with, when I look for like strategies, it's like mindfulness, do mindfulness. And I was like,
Mm.
wow, mindfulness will just work for everything.
Mm. So one of the things that somatic therapy is really good for is treating trauma. And somatic therapy is really something that looks at um, a treatment focusing on the body and how emotions appear within the body. Somatic therapies point that our posit that our body holds and expresses experiences and emotions, and traumatic events are unresolved emotional issues and can become trapped inside. So one of the ideas that works is that one of the things that works is that our feelings and emotions get trapped inside our body, and now they're trying to come out, and somatic therapy will help release that. One of the things that you're really into, and we'll go back to that in a second, is running. You and Lisa, I don't know what's wrong with you, but y'all like running. How did you get into running, and why do you like running so much?
um, I got into running
Because it's
because it
stupid.
was
Very good. Okay, next one. I'm kidding. Go ahead.
no, because it was a cheap way to to lose weight, but more so to be healthy.
Mm,
At the time, I was starting to play high school sports, and I knew I needed to be a little bit more fast.
mm-hmm.
So that's the real reason that I started running was because of that.
Mm,
I continue to run in my I continue to run because it helps lose weight, really. That's the key thing. Um, but I started to fall in love with it because as I got better at it, there was a lot less focus on the running and just really focusing on my breathing and that
mm,
and when the endorphins hit, um and you just there were times where you didn't have to think and you would just run and it felt euphoric.
mm-hmm.
um and that's what I liked about running.
Yeah.
Running also, you can do a lot of different things with it to gauge your strength, like the sprinting, the long distance, how long it takes you to run a mile. So like, again, being a BCBA, the data was always cool to see as well because I was always monitoring my runs in the sense of how long it would take me every time I did the run. And then when I would get bored, I would switch to like sprinting, between the light posts or the blocks or between
Mm,
like three houses, and I would do that. And that's why running foremost was healthiness and to lose weight at a quicker rate than just eating right healthy.
mm-hmm.
Um,
Mm-hmm.
and now I do 5Ks because I like the competitiveness and talking smack with my family. Yeah, yeah.
Oh, that's so much fun.
Yeah, it is.
Um, People who benefit from somatic therapy. Um, Disturbing feelings and emotions often show up in other debilitating ways. Somatic therapy aims to drain those emotions of their power, relieving pain and other manifestations of stress, such as disruptive sleep or inability to concentrate. So, a lot of people will run when they want to distract. We tell our guys all the time, go for a walk. And I know we're not going to tell them go for a run because why would they want to exercise? But we tell them go for a walk or, go outside and get nature because it really helps deal with a lot of things, such as post traumatic stress disorder, PTSD, complicated grief, depression, anxiety, trust and intimacy issues, self esteem problems. We talk about what somatic therapy can be used for. Think about how much better you felt when you started to lose weight after you ran. Then after you run for a while, and it does get better, where you can compete, you can talk shit. Some people don't even feel comfortable doing that in this situation because they're like, well, you're self-conscious about yourself. How do you relieve those tensions without kind of manifesting it physically?
I'm the worst runner out of my whole family. I'm always last, and I still will talk smack because it's just fun. And I can do that with my group because it's my
Mm-hmm.
family.
Mm-hmm.
Um, but yeah, so I haven't. I ran, I ran once this month,
Mm-hmm.
um, and so the last 2 days, the weather's been great, and I have puppies, so I've been taking them out for longer amounts of time,
Mm-hmm.
uh, for them so they can pee, but also for just me. And I didn't have my earphones in to listen to music because I got to keep an eye on them. So I was like, you know what? I'll just walk around like the perimeter of my house, and my whole mind just started like problem solving on its own, and I was like, wow, those are some really great ideas for me.
Mm-hmm.
um because the sun was beating down, it was nice and warm, considering I was sick as a dog and I still did that.
Mm-hmm.
Maybe I was just delusional.
That's
um
okay.
but with the sun and just being outside, like, and I thought to myself, I was like, oh, this is why people say you should, when you're in a funk, you should really go outside and take a walk. So I was doing my own somatic therapy without even knowing it.
I love it. So, anxiety can lead to muscle tension, particularly in the neck, shoulders, jaw, and back. It can cause a lot of discomfort, pain, stiffness, and trouble with daily activities. If you're experiencing chronic anxiety or distress, it's almost like we have our foot on the gas pedal. It's not a panic attack, but we're never feeling a reprieve, and there's a constant wear and tear on the body. So, the somatic effects of anxiety, I see so much anxiety in the practice. I see so many people that are anxious, and anxiety is one of the stepping stones to depression, to stress, suicidality, which we'll be talking about next month with Mr. Mark. That's, a lot of these things are build up and build on one another when you don't think it's anxiety, but it starts off at A and it piles up and then it's B, C, D, E, and F. Um, in somatic therapy, the body is the starting point to achieve healing. This form of therapy cultivates an awareness of body sensations and teaches people to feel safe in their bodies while exploring thoughts, emotions, and memories. This is one of the things that Lisa actually does with her running coaching. That she talks about having conversations with people, and they're just when they're running, she's like, we just like to talk, and it feels for a relief for so many people. Did you only run with your family, or do you ever run with other people that are psychotic like you?
um I used to run with Kevin, and then I got mad at him because he ran faster than me. So we stopped running together.
I'm sorry, Kevin.
No, usually, what I have done is I'll do walks. I'll do walks with people.
Okay.
Um, and then it's like a gab fest, but more so like it's usually a lot more of them talking and me just listening and confirming and validating their feelings and stuff like that. Um, Sometimes, like if I have something that's like really bothering me, and I
Mm,
talk about it, but for the most part, it's usually whoever I'm walking with that I'm talking to.
mm,
But I'll do like when I'm stuck with a plan or something that I'm trying to figure out,
mm,
um, I'll pace walk in my office, and usually it's like in the evening, so it's like dead, and I'll pace my office just so I can process and think
mm.
about how I'm going to work through a plan and how to write it so that staff can understand it and be trained on it.
And then you
Um,
rewrite
and,
it
and
again because they're vapid.
I rewrite it again so it's not so wordy. That's my new
Mm,
thing, is not making everything so wordy.
I see. That
Yeah.
makes sense. Um, so people talk about comparing somatic therapy to other therapies, like CBT, cognitive behavior therapy, focuses on conscious thought and working on challenging those thoughts in relation to anxiety and behaviors. Somatic therapy is more about relieving the tension as opposed to desensitizing people to it, which is an interesting way of approaching it. I'm trying to relieve and release, help you release that tension, as opposed to, making you immune to it. Mindfulness meditation, which you were talking about before, lets any feelings or emotions come into our mind without judgment, as opposed to homing in on specifically on bodily sensations that are happening. So it's focusing on the sensations and how you feel in a moment, as opposed to the thoughts, which you're not, which meditation lets in feelings. So I think meditation is a way, but I think the difference is that um, somatic therapy is more like focusing on how your body feels doing it. And I tell what I do with a lot of my guys that are on the spectrum in ADHD. I'll tell parents, and if there's behavior, I said, don't ask them why they're upset. Ask them what their body's telling them, because a lot of
Mm.
times that's an easier way to desensitize or titrate down when somebody's having a meltdown or somebody's having a tantrum or somebody's really frustrated. But you have more experience with that than me. What are your thoughts?
No, that's a good thought. Usually it's for the people that I work with, it's explaining to staff, stop telling them to calm down.
They need to
So
calm down.
don't tell them to calm down, because every time you tell them to calm down, I'm gonna take a wild guess and say they get more upset, and they're like, "Yes, yeah, that's why." I think um I'm trying to think. It's usually I don't really have them talk about their sensations of their body, but I think that's not true. I have one girl that I use a thermometer image, the visual
Mm.
thermometer,
Mm-hmm.
and where it's supposed to be hot, um, and I'm like, I'll pair the emotions with how she's feeling, you know.
Mm.
So I did that for a couple of my ladies, and it was actually doing a really good job, like for them, like explaining to them, like, okay, how do you feel, and then I also have to give them scenarios that we've gone through, where I know what the key emotion is, and then they'll explain to me what their body felt, and that was helping a lot, especially like shaking. Like
Mm.
you knew one of the ladies were upset when her hands, like she had like a little shake to it, a little. She would just be like that, right? Like that. And
Mm.
then when she started getting anxious, the hand would just go like that. So I'm like, whenever you see a more fast-paced hand, I'm like, we're getting anxious and we need to try and redirect her and get her to like a safer spot to kind of cope and stuff.
Mm.
So technically I was kind of doing some somatic stuff without realizing it was somatic.
Mm-hmm. I think we do a lot of that just from our indirect training. I think that, ABA, as you know, and behavior management is a crossover of a lot of different things. And
Yeah.
I think that's really important. Some of the things that you can do in somatic therapy with body awareness, which helps you people recognize tension spots in the body as well as conjure calming thoughts. Pendulation, which sounds really fun, which guides people from a relaxed state to emotions similar to their traumatic experiences and then back to the relaxed state. Now,
Oh, wow.
yeah, I think we do this a little bit when we know we're going to trigger somebody. And I always tell staff, if you're going to trigger somebody, know that you can calm them down. Because
Yeah.
sometimes you need to see things in action to be able to better approach it. So I think that's important, that if I'm going to trigger you, I should also be able to titrate you down. Titration, which guides people through a traumatic memory while noting any accompanying physical sensations and addressing them in real time. Oh, that doesn't sound fun. Resourcing, which helps people recall resources in their lives that promote feelings of calm and safety, such as special people and places.
We do that.
Yes.
But we call it, when you're upset, who's your preferred staff?
Yeah.
Or, who do you prefer to talk to when you're upset that's going to help you feel calm?
Yep. So yeah, I mean, it's in different ways. Oh, that was weird.
Yeah.
I don't know what happened, people. I think one of the ways that we deal with people is very much multifaceted. I do think that we always have to take how somebody's feeling into consideration with what we do. I know in therapy, if somebody is not feeling good or has a headache, I have a lot of people with ADHD that report headaches and stomach aches, but because there's usually a connection between how much they eat and how they deal with food. I know Armani wouldn't eat green food for the longest time, and his favorite color is green. I don't even think he eats green food now, but you could. I was just like, what? How do you hate green food? Just why?
Yep. Is it a vegetable? Then
No,
I
it's
don't.
the color green. He didn't like
Oh
food that
no.
color
E-
green.
Ethan's favorite color is green, but he will not eat any vegetables.
Jake, hello, sir. We probably won't say that because we don't want to get punched in the face. Um, and as a therapist, that's probably not the best way. But I do support you, sir. And this is a safe place, safe space. And we thank you for your input.
Is this your self-talking? I like
If you
that's
say that to yourself,
if that's your
maybe.
self-talk, then yes. Like if a client was like, "Well, this is what I tell myself so I can get out and start my day," then I would be like, "Okay,"
Yeah,
and I'll
after
give
your feelings.
examples. Yeah, I'll be like, "All right, cool." I mean, I'll self-talk too, and
Right.
I'll be like, "Come on, you got this."
Uh,
Uh,
you're right. I mean, we usually probably go more positive with our self-talk than f your feelings. I do think that one of the things that I've always done for in forms of somatic therapy is probably basketball. I've done that for a long time.
yeah.
It's always been an outlet. I could always go to the court and just forget about stuff. I know you run now and do 5Ks, which just sounds like it hurts, and 10Ks and 11Ks and 13Ks and all
Mhm.
that stuff. I like
I
to
used to
do
swim. I used to do a
every
lot of
sport.
I used to do a lot of swimming, and before that, I would do the step machine, and what else did I do? I would do like tricep dips
Right.
at my in my room, like just to help. So so it wasn't just running.
But who runs and then says, "Oh, I want to do tricep dips and swim too"?
Me.
I have a general disdain for exercising, and I've always been like that. I never liked really being in the gym. I did it because I had to. That's probably why. I do think that
Mm,
college sports beat it out of me. I didn't. I don't want to run. I didn't. I had to be in shape 9 months out of the year, 10 months,
right.
because basketball season started. Really started in September when we got to school, and it went to the end of February, March. and then
Mm.
I would take a couple of weeks off, and then I had to get back into the gym, working out and stuff like that. So it's a lot. Like when I work with these girls, they don't understand the intensity of all the work we had to do to get better.
No, they don't. I didn't have the pleasure of playing college ball, but I had the pleasure of dealing with my high school coach, and she was very big on fundamentals and running. So, which is funny because I hated doing it for basketball, the sprints and everything, the suicides,
Ugh.
but I come to I come to love it now. I'm I
That
miss it.
sounds.
I miss it, and then I have to do it, and I'm like, no, no, I don't miss it that much.
No, you were like, yeah, I was gonna start. No, no, and I think that that's one of the big things. I think that's probably one of the intrinsic benefits of somatic therapy and stuff like that is probably just doing it all the time. Like knowing that you get the motivation. That's really big for depression and anxiety where
Uh,
I'm not worried about not doing it. Um, that's debatable.
Cardio is
When you're
key.
playing on a team in school, yes.
Yeah, yeah.
But you learn ways around it as you become
As you get
been playing
older.
long enough. Yes. And just when you've been playing long enough, you know when you can rest and it's not constant running like running. Because people are like, oh,
Mhm.
basketball's a lot of running. It's
Uh,
debatable. Debatable.
yeah. If you have a lot of breakaways, then
Yes.
you're like, yeah,
Yeah.
ah,
But then
ah.
that's when you let the fast people run and you
Yep.
just kind of, oh, I just get to half court. Oh, you're coming back already. Oh, we go back to half court. Oh, um, yeah. So, this was really the topic Lisa wanted to do. Me and Em wanted to make sure that we came and gave you guys something to think about. Um, Final thoughts, Miss
Uh,
Emmeline Denton.
Denton. Um, I think you have something here that says health insurance may be more likely to cover somatic therapies,
Mm.
but it doesn't have the same research backing yet as
Yeah.
CBT and some other forms of therapy.
Mm.
And like when I was doing like physical therapy for my knee, and I kind of wanted to like get like a mobility and also like a running program situated with them.
Yeah.
Um, my insurance was like, no. And I'm like, but those are the two things that are going to keep me out of surgery and physical therapy. And they were like, yeah, no, denied. So if somatic therapy is something that is going to be, is that health services are going to cover, that's awesome because maybe more people would actually do it because, you know,
I mean, it
they
has
don't,
a lot of
it doesn't
influence.
have to be paid out of pocket. But I feel like also somatic therapy, some of it is just, you can do it, you can do it outside. You
Yes.
could do some things outside, but for those more like traumatic experience, I think that's the thing. Like the more traumatic experiences that that people are going through and need someone to kind of be there to help them cope with it is where we're not really going into that, and that would be cool for like for Lisa to kind of explain that part
Yeah.
of it because this is where I'm not in my scope whatsoever. What does the badass ABA
Did you see your
mean?
name?
Yeah, I saw my name. I'm the badass ABA. So everything up to the ABA part is correct, and then ABA is applied behavior analysis.
What is that, M? Since he asked. I think he's asking what
I
ABA is.
I'm a board certified behavior analysis, and we use research. Um, oh my God, we use research backing procedures and techniques. So It's a lot of like a lot of repetition. We write behavior plans, so that way we can help either increase behaviors or decrease behaviors, using reinforcement schedules and or removing of negative and positive reinforcement. It really depends on where you are. Like there's a lot of school-based ABA, so that's a lot of like if you're younger, that's a lot of discrete trials, a lot of repetition. And as you get older, we do a lot more like a naturalistic teaching in the sense where we're trying to build in reinforcement into your life as opposed to reinforcing you after every task that you do like when you're younger.
Mm. What you said.
There's a, there's a lot. There's a lot. You can
There's a
do a
lot.
lot with ABA. In New York State, you can only do you're welcome. In New York State, you can only work with people who are diagnosed with autism or can benefit from ABA. However, people will use ABA for statistics, for personalized coaching, for losing weight or gaining weight. There's so many things that people in other states and countries are utilizing ABA for that we necessarily don't in New York.
No, and I think that because it's limited to the autistic population here, that it kind of handcuffs it a little bit because it has the potential to be a lot of stuff and be used a lot. And I don't the way it's delivered here sometimes, not M, but the way other people deliver it in some of these other it's not as effective.
It can be very pretentious.
Yeah, pretentious.
It can be very pretentious. Like, yeah, people with it.
So, I think that's about all she wrote. And looks like she's about to fall out her seat. She's been sick, so she braved. She said, "I'm gonna put on my backpack and my army gear and my boots, and I'm gonna tough it out for you." And she got up out of her couch and went 8 feet to her table and said, "I'm gonna do this."
Pretty
Next
much.
episode, I'm going to give a disclaimer now. We're talking about heavy stuff. We're talking about suicidality and self-harm with Mark. I think M will be back. I'm not positive. It's going to be March 23rd at 8 p.m. Eastern Standard Time. So that will be super fun. We're going to talk about suicide and the uptick in, I've heard a lot of, the middle school kind of age kids dealing with suicide, and dealing with the stress and dealing with not being able to deal with things and not being able to navigate through life. The self-harm piece, when one of my clients told me, "Yeah, I cut." I said, "Oh, what'd you use to cut?" Thinking they were going to say something silly, thinking they were going to say like glass. They're like, "Oh yeah, no, I used a box cutter." Ooh.
Oh my goodness.
Yeah. So I was just like, that's heavy. So this is going to be a heavy talk. We're going to talk about suicide. Mark worked at the Suicide Awareness Hotline. He wrote a book. It's called The Alchemy Way, I believe, where he talks about dealing with that. When I just drunkery talk about dumb shit, so good. You're a fool, Jake. Then that's March. April, I'm trying to nail Colleen down for a date to talk about trauma. Then April and May, we're talking about ADHD and executive dysfunction. And then in June, that's right, June, we're talking about depression and anxiety. Mark is going to come back and talk about that. He's a big fan. Michelle Pierre might come on. So we have a lot of fun stuff set up for you guys on Joker LMHC Presents. All right. So,
where can I follow you?
Instagram. He wants more information.
I don't have like an ABA page, but
Jake, we will get back to you. If you want to talk information, I can give you her Facebook, and you can
Yeah,
message her. She likes talking about the shit. I don't know why. It's fine. I
I
love
do.
ABA.
I just it's yeah, I'm trying to think. Like I don't even know what I'm on Instagram and I'm on Facebook, but I'm not really um I don't have it for ABA.
So what it means is she doesn't have for educational purposes as of yet, but we're
Yes.
working on that.
I have it personal, not for educational purposes. Great, more work on my plate. Thanks.
I try to bring on people who have knowledge. Jake, if you really want to, the ADHD episode, and then when we talk about M specialty, I don't remember when we do it. Hold
what
on.
what's my specialty?
Autism. Um, Autism's not till next year.
Mm.
Autism's episode 18, which is probably going to be like a year away. So we'll have time to prepare for that.
Mm.
All right, peeps. I appreciate you all, Jake. Jake, thank you. Mr. Jimmy Nails, I know you were there somewhere. I don't know if you're gone. M, thank you for coming on. It's much
No problem.
appreciated.
Always.
You hold on. I'm going to kick you guys out.
Bye.
5, 4, boom. It's just me and me and me.